just to lay it out there for the people who watch this podcast to be clear on this, is that the workup requires, in my practice at least, is a test called MRA to look at the arteries, and the test called MRV, which is an MRI to look at the veins, and assessment by an ENT or audiologist. I think an audiogram is very important because you want to make sure that the hearing is intact or almost intact when you're evaluating a patient pulsatile tinnitus. So these three tests I ask for every patient. Now, in terms of what are the indirect signs, or what is the patient experience when they try to figure out what they have, I think it's important to understand or try to understand if they have pulsatile versus the regular tinnitus. They can try a few different things. One is try to feel their pulse and see if that sound matches with the rate of their pulse matches the rate of the rhythm of the sound that they hear. Sometimes patients with venous problems, if they press on their neck with gently on the side of the pulsatile tinnitus, it may resolve or almost resolve. This happens because by pressing on the jugular vein in the neck, you change the blood flow in the vein that is causing the pulsatile tinnitus. So that's a very telling sign of having pulsatile tinnitus from a venous cause. And again, another issue is the changes of the intensity and the rate of pulsatile tinnitus with exertion versus relaxation, because as the blood pressure and the heart rates change when somebody exerts themselves, then the opposite can happen when they relax, and the pulsatile tinnitus rhythm goes along those changes. I think what I learned over years from patients is that sometimes you have to insist on getting the workup you deserve. And some of these things are very important to be ruled out for the overall health of the patient. I think there is improvement in the last few years, but again, mostly because of patient education and the patient support groups. But there's a lot more to be done.
One thing that I have come across helping patients with tinnitus in different places, sometimes they live in a rural community. And what I have found is a helpful tool is to recommend to have a full workup of your pulsatile tinnitus. Contact the largest university medical center within your area and ask them, do you have services for pulsatile tinnitus? I've found that that's successful of seeking a city, seeking an urban medical center. Oftentimes there's a concentration of qualified doctors there. Would you agree with that?
Well, I think at the very minimum, they should be able to get good quality imaging and good quality workup. I think that very few doctors specialize in pulsatile tinnitus seriously, meaning understanding the nuances of the rare problems, when to treat, when to observe, the ramifications of treatment. Not every patient with a vascular change who has pulsatile tinnitus needs surgery, minimal invasive or not. This is a decision that depends on the risk of having that condition that causes pulsatile tinnitus, as well as the potential risk of treatment and the expertise of the surgeon. And as you alluded to earlier, there are a lot of patients that don't necessarily need surgery. They need reassurance. I think that's key. Reassure a patient that, yes, you hear your heartbeat in your ear, but there is no condition that is life-threatening or that is ominous for you. So I think that goes a long way. And then there's other means, is like sound masking, psychological support. There is sometimes the hearing aids help, or even there are patients that I've seen that benefited from physical therapy for neck or vestibular physical therapy. So it doesn't mean that patients necessarily are going to end up having surgery. I would probably say the majority of patients do not need surgery, and they need other treatments. But yes, at least at the very least, they should have proper workup. And I think in a urban setting or in a big university setting, hospital setting, that should be done. And then then it's also easy for them to get second opinions, reach specialists, even if they're far.
If you follow Treble Health and get value from these videos, I would highly recommend that you watch the full video from this clip right here, or subscribe to this clips channel. Every little bit counts, and your support means the world to me. This is Dr. Ben Thompson with Treble Health.